Hey there. So aircraft carriers and launching and all those metaphors come to mind when you see that space and
Yes.
Yeah, I'll say. It looks like a flight deck.
yeah.
You could put an F-18 on there.
Yep.
Okay, we are live.
And its tug.
Yeah.
All right, we are live. I'm going to call the meeting to order. Good morning as we come from our new space that we all look forward to being together there in person. I want to thank you all for joining me. We are meeting by electronic means today as permitted by Virginia law during the state of emergency declared by the governor due to COVID-19. This meeting will be held in both open and closed session. The open session is being live streamed and recorded. Following a motion and vote by the committee to convene in closed session, members of the committee and EVMS personnel will leave the open session and proceed in closed session. Following closed session, the committee will return to open session to certify that only public business matters lawfully exempted from the open meeting were discussed, in which were identified in the motion authorizing the closed session were heard, discussed, or considered in closed session. All those will be taken today will be done by roll call vote. So we've got the minutes for the September meeting that we need to approve. Those are all attached. Are there any edits to those meetings? Corrections, additions? Raise your hand if there are. Seeing and hearing none, is there a motion to approve the minutes?
Move to approve the minutes.
All in favor?
Aye.
Raise your hand for that. All right, do we need a roll call on that, Tracy?
Yes, ma'am.
All
Ms.
right.
Bishop,
Yes?
Dr. Emery,
Yes.
Dr. Martin,
Yes.
Dr. Waldholz,
Yes.
Dr. Wagner,
Yes.
Rear Admiral Bianchi.
Yes.
Okay, roll call vote complete.
All right. There is, now we need a motion to go into closed section pursuant to the Code of Virginia, section 2.2-3712A to discuss prospective business collaborations and specific proprietary business-related information pertaining to EVMS. Is there a motion to go into closed session?
Move to go into closed session.
All right.
Second.
Tracy?
Okay, Ms. Bishop,
Yes?
Dr. Emery,
Yes.
Dr. Martin,
Yes.
Dr. Waldholz,
Yes.
Dr. Wagner,
Yes.
and Rear Admiral Bianchi.
Yes.
Okay, Ms. Bishop, roll call vote is complete.
Could you please end the stream? They're going into closed session.
All right, thank you.
Bishop, we're live.
All right. I am asking for a motion to come out of closed session and to certify that to the best of our knowledge, only public business matters lawfully exempted from the open meeting requirements that were identified in the motion authorizing the closed session were heard, discussed, or considered in closed session. Is there a motion?
Move that we come out of closed session.
And a second?
Second.
Second.
Okay, roll call vote?
Yes, Ms. Bishop,
Yes?
Dr. Emery,
Yes.
Dr. Martin,
Yes?
Dr. Waldholz,
Yes.
Dr. Wagner,
Yes.
Rear Admiral Bianchi.
Yes.
Okay, Ms. Bishop, roll call vote is complete.
Thank you. Now on the retreat, there's an interest to have a retreat. It's been expressed by the members. I am very conscious of the time that is being required by administration on this issue and on all that's going on in addition to accreditation preparation and everything. And so I want to put on the table that this is now our time to talk about coming together sometime this winter or spring, and is that something that would be valuable to both management and the board to come together? And is it possible to do it in a way that is safe, given the COVID restraints and concerns?
So Sarah, I would just say briefly that I think it's important to have a retreat, to have the opportunity for the board to come together for a period of time that we designate, and looking at specific concerns or issues, and maybe more importantly, looking at our strategic plan, taking a deeper dive into areas such as research, how we increase research, how we increase the number of faculty. I know it all takes funds to get that done, education, the clinical enterprise, those types of things that are part of the strategic plan, so that board members have are better informed and can perhaps invite members of our EVMS medical group, students to hear students' input, members of the community as well, and individuals such as Harry Lester, people who have a lot of memory about the institution and perhaps thoughts about where it should be going. So now it's not necessarily, it's not one of those issues that we have to address and have done in the next month or two, from my perspective. I mean, I think could be a late spring, early summer, and I do think we should annualize a retreat. So it's an opportunity to come together aside from the quarterly meetings. And there's lots that we could talk about and lots of progress I think that we can make.
Anyone else around the table? Dr. Walters?
I think it's a wonderful idea. I'm a little bit concerned about COVID until when we're all going to be vaccinated, our students and everybody else. Certainly being able to look at a 5-year strategic plan and where we hope our students, sports scores, residents, research, and everything else would be a wonderful idea. So I agree with Dr. Martin. Is there a way to sort of pick a time frame now when we think it will be healthy, healthy and safe? We have to think about the format, but in principle, I think it's a great idea. As soon as we can safely do it.
Yeah.
Dr. Hellman, what is your read on timing of all the matters, including given COVID? Is this something that you see a benefit to you in your communication with the board over the next 3 months or 6 months?
Well, I just appreciate all these Zoom meetings that we've had to be able to, inform you and you push back on me to be able to refine the strategy. Right now, I'm working more tactically to make sure that we can develop a plan for the path forward, identify ways to be able to be united as an institution, and be prepared for the opportunities for us to engage the other institutions in this community to collectively improve the health of the region and address the health disparities that we also know so well, unfortunately, in this community. And we can make a big impact on that if we all work collectively and together in an open and transparent and mutually respected process. And so my goal is to Number one is to maintain our accreditation through LCMA, because we're still have an open process there that their board is not met, and then prepare for the SACS accreditation. As we, in parallel with that, work on opportunities for us to be able to engage the community in a transparent, open, and public forum to improve the health of the region. And I need your help to be able, and welcome your help and involvement in that process as well.
Thank you. I agree with that. And I think at this moment in time, our focus is just what you said, the accreditation with LCME, SACS accreditation, and the path forward plan, and really focusing on the transparency of the process. I do think a retreat would be good. I think it is important to have retreats reflect the current state of affairs. And we have some pressing issues right now, and I think that if we are to do that, we should focus on these to be addressing the Board of Visitors impact. In other words, not the management. You know, there's a lot of the medical school that they're dealing with, but we have specific roles, and as a BOV, and so I think it's important for us to understand, you know, what those are in relationship to where we are and where we expect to go in the future.
Agree.
Dr. Emery, are you thinking that you'd want to retreat in the springtime, the winter? You have a timeline that you have in mind during your tenure?
So I haven't, because again, COVID is sort of, I think that before I would be comfortable, we would either have to continue a remote retreat, or we're going to have to find a way that is safe. We have people of variable ages and health conditions on the board, and I think it's imperative that we not do anything that makes people uncomfortable. It may be that we would have a hybrid model at some point, but I think we're too soon to do that at this point. So I would say I would ask management to look at options and opportunities for us, and help us to find a way to do a retreat in a safe way that meets our desired goals, but also is protective.
Yes.
So I will, go ahead.
Yes, Ms. Bishop, and I know we're about to run out of time. I think too, considering LCME and SACS visits coming up and determinations there, and the community engagement and engagement of ODU and Centera within the next 6 months, and COVID, that perhaps we should be looking at late spring or summer as the earliest, but not in the next couple months.
Will that work for you, Dr. Emery and Dr. Hellman? Something to
Sure.
share? Okay, I will
Of
report
course,
that.
I'll take your
Maybe
direction.
looking towards second, third quarter.
All right. Thank you very much.
Thank you.
And I am happy to survey, with Stacy's help, so easy for me to say this, right? The board on suggestions for retreat topics, so they've been heard. If that would help us come up with some things for us to consider for retreat topics.
Okay.
Good idea.
Thanks.
Good idea.
Thank you very much. Is there anything else that could come before the governance committee? Hearing none, we are adjourned.
Thank you.
Thank
Well done.
you.
We haven't.
Hear me? See what's going on here.
I can hear you, sir, but your signal is dropping in and out, sir.
Okay. Let me move to a different place. How about now?
We can hear you. We haven't seen you. We saw you briefly. We can hear you. But we can't see you.
Okay.
There you go.
Okay, so first I'd like to make a motion. Do we have a motion for approval of the minutes from September 15th? I'd like to have a motion, please.
So moved.
And second. Okay, Yolanda, can we do the roll call, please?
Yes. Good morning, everyone. Mr. Frame? Ms. Goodwin? Ms. Scott?
Yes.
Mr. Hughes?
Yes.
Dr. Joffrey?
Yes.
Dr. Lindsay? Dr. Martin?
Yes.
Ms. Morris?
Yes.
Dr. Walthouse?
Yes.
That's it. That's everyone.
Very good. Our first report will be from Vice Provost and Faculty Affairs on Institutional Effectiveness, Dr. Maloney. You have the floor.
Thank you. Thank you. We'll start with the appointments and promotions of faculties. I'm seeking the endorsement of the following faculty appointments and promotions, starting with the appointment of Dr. Graham from associate professor in the Department of Emergency Medicine. And moving into promotions, we have a full-time salary faculty, Dr. Matrugi, from associate professor to professor effective July of 2021. Dr. Gohan from associate to full professor in the Department of Pediatrics, again effective July 1st of 2020. And the Dr. Klinghammer from the Department of Emergency Medicine, from assistant to associate professor effective July of 2021. Those appointments have been approved by the Appointment and Promotion Committee, and I'm seeking your endorsement.
Okay, so we have the faculty actions for approval. Can we have a motion for approval for the recommendations made by Dr. Maloney?
Move approval.
Second.
Okay, Yolanda, can you do the roll call, please?
Yes, sir. Mr. Frame? Ms. Goodwin? Ms. Scott?
Yes.
Mr. Hughes?
Yes.
Dr. Joffrey?
Yes.
Dr. Lindsay? Dr. Martin?
Yes.
Ms. Morris?
Yes.
Dr. Walthouse?
Yes.
Thank you. The second item is the establishment of a new center. So the Department of OBGYN has put forward a proposal for the development of a new center for maternal and child health equity and advocacy. The mission of the center, as it states in the proposal, is to reduce health disparity for mothers and their children by focusing on clinical practice quality and safety using epidemiological and effectiveness data to drive guidelines, but also policy. The center is to bring together different types of expertise, including clinicians, researchers, population health professionals, but also policy experts, to collaborate on clinical trials, on quality improvement projects and health services research that will have an economic and health policy impact in the area. As we know, there is significant health disparity in maternal morbidity and mortality and infant mortality in Virginia, in the state of Virginia, and in Hamptons Road. So the OBGYN department is the sole provider of indigent care for high-risk pregnancies in Hamptons Road. It is therefore expected that the center will have significant impact in reducing healthcare disparities in the area, which aligns very well with the mission of our school. The proposal includes a robust organizational structure that has a director that has been identified. He's going to join us in September, and Dr. Bahaman proposes to serve as a director until the new faculty joins EVMS, a core faculty, administrative support, and an advisory board that includes internal and external experts. Funding has been secured using funds from the President's office, but also departmental reserves. The proposal has been reviewed and approved by the Faculty Senate earlier this month, and we're seeking your endorsement so we can move forward with the implementation of the center.
Okay. Thank you, Dr. Malone. Any questions?
No, Dr. Walthouse. Go ahead, sir.
No, I was just going to say, one of the things that we've talked about as a board is that of the health inequalities that we have in our region, in addition, in the African-American community with prostate cancer mortality, colon cancer mortality, infant mortality, I believe is about double within our region. And the benefit and the need to help with this and to change and help our community is just essential. Dr. Martin?
Yes. Yeah, no, I would agree wholeheartedly. Infant mortality rate for African-American women in Central Virginia is high as well. Certainly very high in the Hampton Roads, and it's higher than in some developing countries. I spent a decade working with students in the health infrastructure in developing country, St. Kitts and Nevis, and the infant mortality rate for African-American women there is lower than it is in Hampton Roads. It's closer to what it is for the national rate here. And interestingly, there are lots of research can be done. There's some research that's been done already on African-born women living in this country having an infant mortality rate similar to white women, and much lower than African-American women born in this country. So there's something to do with stress, maybe the relics related to slavery. I mean, that's not too far-fetched in terms of intrauterine stress. So I could go on and on with that. So having this center is very, very important for all the reasons we've talked about and all the reasons that's stated in the proposal. I fully support it.
Well, that's excellent. I know that we have the opportunity in areas that have worked with best practices, working with the African-American congregations and the clergy. I know we've done this for decades in the cancer space, and it's really very, very exciting time and long overdue. Can we have a motion for approval for the Center for Maternal and Child Health Equity and Advocacy?
As an OBGYN, I'm very proud to make a motion to support the center.
And I second.
Can we have a roll call, please, Yolanda? This is very exciting.
Yes, that's true. Ms. Scott?
Yes.
Mr. Hughes?
Yes.
Dr. Joffrey?
Wholeheartedly, yes.
Dr. Martin?
Yes.
Ms. Morris?
Emphatic yes.
Dr. Walthouse?
Yes. Well, Dr. Joffrey's motion passes, and we vote on a lot of things, but it's really very exciting and heartwarming to pass on something that's going to make a difference in our community and save lives. So wonderful.
Thank you so much. Lastly, I'm seeking your approval of graduates in various programs in the School of Health Professions. The list of graduates is in one of your documents in your handouts. The list was presented at the General Faculty Meeting by Dr. Combs back in October of 2020. again, we're seeking your approval of these graduates.
Do we have any questions for Dr. Malona or comments? Okay, if not, can we have a motion for the appointment, the presentation of these candidates for the degrees?
Move approval.
Second.
Okay, Yolanda, can we please have a roll call vote?
Ms. Scott,
Yes.
Mr. Hughes,
Yes.
Dr. Joffrey,
Yes.
Dr. Martin,
Yes.
Ms. Morris,
Yes.
Dr. Walters.
Yes.
Just a reminder that when the formal motion is written out, it needs to be subject to the completion of degree requirements.
Absolutely. Spoken like a dean. Okay, we will next move forward to very exciting part. Always enjoy hearing from Dr. Flenner to see and really figure out the magic sauce for how he is able to get our students to do so well in their test scores. They're matching their interviews, particularly at this very, very challenging time. So Vice Dean of Academic Affairs, Dr. Ronald Flenner, you're on.
Good morning to everyone. So I thought I would just share with you the results of our LCME survey team visit, which occurred October 5th and 6th of this year. So since this committee last met. Overall, we had, I think, a very positive visit from the survey team, and we most recently received our letter from that team about a week or so ago. And just as a reminder, the LCME committee itself meets in February, and January, we will receive our final information document from that committee in February of 2021. But I'll share with you the findings that were shared with us from the survey team itself. So it occurred, I hope everyone can see this screen, yes?
Yes.
Okay, yes. Perfect. So the virtual full visit, it was a virtual visit, which was challenging, but I will have to give credit to our IT team here. They made things run very seamlessly, and in fact, the survey team commented on the efficiency with which the visit occurred and gave kudos to our IT team because they did a fantastic job. It was very challenging with lots of moving parts, but it went incredibly smoothly. We received the survey team findings last week, as I said, and the final accreditation decision will be rendered in February of 2021. The results are expected based on early feedback, so we didn't really have any surprises, and we had, I think, a very cordial and respectful visit with the survey team, and I'll share with you what they have provided with us to date. So of all the elements, they reviewed 12 standards over 93 elements. The elements that they identified needing monitoring but were satisfactory as is included student research opportunities. And I would share with you that we already have been addressing most of these issues with the creation of a director of student research. The curriculum design, review, and revision element, basically they want to know that we are reviewing our curriculum as a whole. You will remember perhaps that this cohort, class of 2020, is the first cohort to complete the Care Forward curriculum that was launched in August of 2016. So we are required, obligated, and we're actually are imposed not only from the LCME but ourselves to review the outcomes of the curriculum as a whole. And we already have a plan underway, likely to engage an external consultant to remove any bias that may be present to look at our curriculum as a whole, particularly again with the first cohort. Program outcomes evaluation, much the same, looking at what are the outcomes of our entire MD program. Student satisfaction with health services, we knew that that was going to be an issue. You all, I think, were informed of the creation of the new Student Health Center, and obviously we have some follow-up to do in terms of student satisfaction rates with that center. We received unsatisfactory marks in element 5.11, student study, lounge, storage space, and call rooms. That's related to the space that's available not only on campus, but in the hospital as well. Specifically at Sentara Norfolk General Hospital on the 8th floor, the students did not have adequate space for storing their belongings when they were in the hospital or on call. Call rooms were in a poor state of repair. All of that is being addressed. EVMS has purchased lockers. They actually have been installed. We just have to advertise to the students that they are free to use them. And there have been visits over there by folks on my team to identify ways that we can improve that space. And Sentara has been very cooperative. All of this was actually in place prior to COVID. We had plans to improve this space, but with the COVID, hospital was shut down. We couldn't have the vendors in there, so that created a delay in that improving that space. They cited us on our instruction on ethical issues related to scientific method and translational research, something that the curriculum committee will need to look at and address by ensuring that we have that important component in our curriculum that's taught and assessed appropriately, and then timely submission of grades. And that relates to clerkship grades. The LCME mandates that clerkship grades are available to students within 6 weeks from the completion of the clerkship. And we had one clerkship where they were delayed, and that is not the fault of the clerkship director or the department, but rather a logistical issue that occurred within my office that is being addressed as we speak. So all in all, I think a very positive visit. And again, the final decision will be rendered in February of 2021. And I, of course, will share that with this group when it's available. So some, I think, pretty minor things and no big surprises, things that we've already started to work on. And we are meeting with Dr. Holman tomorrow to share with him our detailed plans of how we are addressing these issues that were identified by the survey team. Just briefly, Dr. Malona is the chief executive lead for the quality enhancement plan, but I just thought that I would mention the curricular component as it relates to the MD program about our QEP topic, which of course is entitled Live Humble, Practicing with Cultural Humility. So the goal, as you can see, is we want to definitely improve our students' knowledge, skills, values, and cultural humility, structural inequity, and improve their understanding, and hopefully address some of the health inequalities and equities that exist through curricular components. So we will have the virtual SACS visit that Dr. Combs has spoken to many times in the past in February. So again, this committee will not meet prior to their visit, but the initial focus is going to be on the MD program. We did begin the implementation in fall of 2020 with the M1 cohort. Obviously, our initial delivery plan has been modified due to COVID, like everything else, and some of the activities are going to be delivered by alternative methods, modified or delayed as a result of COVID. But we did have a QEP baseline knowledge test that was completed by the M1s in August of 2020 when they arrived. And then to date, there's been some integration through sessions in the human structure module, which we all probably would identify as anatomy, foundational sciences, community engaged learning, which is ongoing, and then ongoing student and physician wellness. So our next steps are to establish what it's going to look like in practice. Then again, Dr. Malona's office will be addressing faculty and professional development training. There's a marketing and communications plan. And then we're going to, in spring of 2021, have curriculum integration where the QEP directors will attend the M1 module orientation, general mechanisms of disease module. They'll be disclosing serious news workshops, clinical skills sessions, culture humility, and personal identity sessions. So these are some of the things that will take place in the spring of 2021. Again, all of this will be rolling out over the ensuing several years, but just to give you a broad understanding of what the QEP looks like in the MD curriculum. And again, that's the only part that I wanted to address today, because the rest is managed by Dr. Malone and the SACS in general by Dr. Combs. But happy to take any questions that anybody might have.
Did you, two questions. One, do you have any comments about I might have missed about the M4s and where we stand right now with the difficulties with students? For example, previously, one of the ways for a student to get into a reach school would be to go to do a rotation at Duke or UVA or Hopkins, and that's not permissible. Is this impacting what we're doing, both in terms of our students and what can we do to help them, if anything?
Yeah, thank you for that question, Dr. Waldholz. This year has been very challenging because, of course, there have been I shouldn't say no opportunities for away rotations. They have been very, very limited. For example, in orthopedic surgery, our orthopedic surgery applicants actually have completed away rotations at UVA and VCU. The AAMC and my colleagues have agreed that it's reasonable for students to have the opportunity for aways if they're pursuing a specialty that is not represented at the home school. We do not have an ortho residency, so we've tried to be accommodating as a group for students in that particular situation. But by and large, there have been no aways other than those special circumstances. That I think has created a challenge for our students. We routinely, through Dr. Hooper's office, solicit students' feedback on the number of interviews that they have received and have asked them to reach out to us if they have received less than 10 interviews. Initially, that number was relatively high, but more recently, I've received emails that students are now receiving more and more interviews. So we don't have so many in that category, but they are occurring far later in the year than they previously have in non-COVID impacted years. It has presented a challenge, but honestly, I've been pleasantly surprised at the quality of the interviews that students have shared with me that they have been able to secure. So I'm more optimistic than I was initially about the upcoming match. Unfortunately, it's going to be the top students at each school who will be receiving the vast majority of the interviews. They will have no limitations on travel. They're all going to be conducted virtually, so they won't be required to decline interviews if they receive them from the top 20 programs in the country. They potentially could actually interview at all of those without the need to travel and et cetera. So it's going to be an interesting year, but of late, I've been a little more optimistic about the prospects for our current fourth years.
Dr. Flinner, this is Marcus. Thank you for the report. Considering the mock survey and the information that's gleaned there, just a couple questions I have related to it. The one area unsatisfactory related to the call rooms. Is that a COVID issue? Is that an ongoing issue? And then the second part of this is the research. One area that needs further monitoring is research for the students. With our need to increase the research base, how will we be addressing that? And then thirdly, I'm sorry, it's three parts of this. I think you can answer it all in one swoop. The information that we got from the mock survey, we address this information. Do we address it and put it in place? Do we inform LCME that we receive this feedback and that we're addressing these issues?
Thank you, Dr. Martin. I'll start with the call room situation. Actually, that was a challenge prior to COVID, but we had a meeting, I recall, it was in January or February of last year, and the Centera, and the folks at Centera who were in charge of the facilities actually were very helpful and very willing and on board to improve the call rooms and the study space and the access to computers, et cetera, on the 8th floor. We had a plan that was moving forward until that abruptly stopped with the impact of COVID, and the outside vendors, et cetera, were no longer granted access, and we suspended clinical activities. So unfortunately, we weren't able to have that in place by the time of the survey team's visit. But it is moving forward. There have been visits to the different places where students have a call to ensure that they have adequate and acceptable call rooms, computer space, working space, et cetera. So that is moving forward. The research issue we addressed already with the creation of Dr. Mew, who has accepted the position for being the director of student research, and we continue to work on that. I will tell you that I think there's always room for improvement in that area to identify research opportunities for students, but at least we have point persons now who are available to students who can help direct them and pursue the opportunities that we have on campus as well as off campus. And then thirdly, yes, we will report to the LCME. Once we receive the report in February, they will specify and dictate the timing of a status report of each of these areas that they've identified as unsatisfactory or satisfactory with a need for monitoring. So we already have started that process. There will be a running document so that when they specify the due date for a status report, it won't be so onerous, and we will be able to respond with all the things that we've done to address this.
Thank you.
Excellent. Other questions? Have just two real briefly. One is because of the interview unusual situation this year, and could you tell us a little bit about when our step one scores, are they not going to be reported starting 2021 match year as pass fail, or the option to reveal your score? Just a little bit curious about that, if it's going to disadvantage our students who can't do an away rotation for the upcoming year.
Allison could probably speak to the date and what our students experience with that have been. I think in general that now the focus obviously is going to shift from step one to step two, and so step two will actually I think be the marker that they use as a filter for granting interviews. And step one, because it won't exist at any school, it's just going to be deferred and going to be redirected towards a focus on step two. So we're fully aware of that, and we want to ensure that our students are going to be successful on step two. In the past, we have a history of good performance on step two, but Dr. Knight sort of has put into place with academic development the same thing we put into place for success on step one, to ensure that we weren't becoming complacent with our good performance on step two, to ensure that it not only continues but improves, because the truth is that's going to be what's going to be used as a filter for granting interviews. And that became very apparent to me this year when we had a student who applied without having even completed all of their requirements for the third year, and because they performed exceptionally well on step exams, has received tremendous number of interviews. So it really speaks to the fact that program directors are laser focused on step one and step two. This person, if you look closely at their application, is not really a very viable candidate for any program, but yet has received, I can't tell you how many interviews, because they performed exceptionally well on step one and step two. So it's very revealing that despite the proclamation of a holistic review, I'm not convinced that that's certainly not in place now. Hopefully that will change over time, but doesn't exist now. So.
Do you think it was specialty specific? In other words, in primary care, are we more interested in the holistic person, whereas perhaps some unique specialty, a surgical specialty, I hate to say it, may be less person focused?
I can tell you that this was this applicant was to a primary care specialty, and again, wow. they looked at the step scores.
Interesting.
Yeah, it's been very interesting this year, though, that what students have shared with me. Surprisingly, they haven't received interviews at some places where historically they would have, and they have, some folks have received, they had a whole mix of competitiveness program in terms of the program's competitiveness, and they received interviews at places where historically I wouldn't have expected that to have happened. So it's really been hard to predict this year.
Well, thank you for all your hard work in a very, very, very difficult, unique, changing environment. I do have one final question. I think this will be for Dr. Knight, but it's and I've mentioned this before about our students at risk, particularly with mental health, and making sure that we don't have as best we can to have a disaster here. It's somewhat curious that we're a healthcare institution and our students are dissatisfied with our healthcare services. And the question would be, because the timing is improved from 9 to 4, and is there something, I guess one question would be, do we know what they're unhappy with? Is it access to mental health, or the timing, or the fact that PA students have required lectures, the fact that perhaps we could ask one of our partners, like a walk-in clinic, perhaps at Norfolk General, relationship with the school in some fashion? In other words, what can we do to help our students, their physical and mental health, to make sure that we're doing the best for them. And what are they unhappy with? Is a legitimate complaint something that we can fix as an institution?
Yes, sir. So the Student Affairs Committee undertook a very comprehensive review of the student health and student health insurance program about 2 years ago now, and that was the data that helped support the formation of the student health clinic. And it was a multifactorial problem, some of which was related to the availability of sessions in the clinic. Our former health clinic was embedded in family medicine, and they would hold student appointments until essentially like the day before, and then release them for community patients, and then students would need to show up that morning. And so then we had a situation where we did not have a consistent provider, and students sometimes were being seen by individuals that could be involved in their education later, which is not only obviously questionable from an ethical practice in terms of student confidentiality. I'm sure the providers handled it as well as they could, but it was also a huge accreditation problem. We also had some very complex problems with billing and having to do with our students, some of which had to do with student health insurance, some of which had to do the interface between EVMS Family Medicine, Centera Labs, all of which and then having a confidential space. And so all of those things have been addressed with the new student health clinic. So for the anecdotal evidence, feedback that I've received from students has been overwhelmingly positive. I'm really appreciative of the efforts that Kurt Stouter and the Department of Family Medicine have done to also work out some of the billing concerns. And we brought in a different lab they've got some internal practices going on because students were getting large bills because of just a communication problem. And then also our human resource department worked to identify a better student health insurance product. So we are planning, actually I was just communicating with Dr. David Taylor Fishwick as the chair of the Student Affairs Committee, and we have a review of the student health planned for early January, February. We can provide updated information to this body when we have more information on the student satisfaction. The student mental health service was also brought into the student health clinic that we also used to be embedded in the Department of Psychiatry and Behavioral Sciences. And while I think students generally felt positive about the services they were receiving, it was obviously a concern for confidentiality that they might see their colleagues as they're sitting waiting to be seen by the psychologists. So moving that into the student health clinic, I'm hoping has alleviated some of those concerns. My primary concern with the student mental health component is the number of sessions that we're currently offering. We are on the low end nationwide. We offer 5 free sessions a year. Some schools don't offer any, so I feel positive about that piece. We would like to bump it up to at least 8, if not 10 to 12. And there's evidence that other schools are doing so. Right now it's a funding issue. And so we are going to be taking a look at that as well. But that, I think, in the student mental health area, that is the primary concern. Dr. Handel has been very proactive during this time of COVID to offer telehealth. He did back when everything went remote. He worked with states around the country to get temporary licenses so that he could provide remote, telehealth services to students all across the country. I think some of that has changed based on different states' licensure requirements and things that, they've pulled back from some initial sort of opening up of borders, so to speak, for mental health services, but he's been very proactive about it. So we're very interested in building that service up, and I'm hopeful that as students continue to use it and the need is there and we can document it, that will provide justification for continued support and increased support.
Excellent. Well, thank you for all your hard work. Obviously, we're an educational institution. We're responsible for all of our students and researchers' education and work product, but we would hope as a healthcare institution that we could do everything we can to really be the best, particularly in these changing times with the use of telemed for the students who can't get in there, in particular, to make sure we're taking care of their psychologic and overall needs. So thank you very, very much.
Dr.
So
Walthouse, Dr. Walthouse, I'm sorry to interrupt you. Can I ask Dr. Flinner one last question to solidify something in my brain? This is very brief. Dr. Flinner, we're talking about student interviews in step 1 and step 2. Are you saying that step 1 and step 2 higher scores, when students are those students are getting more interviews as regardless of the holistic picture application. Oh, you're on mute. He's on mute.
There we go. Can you hear me now?
Yeah.
Okay. Okay, sorry about that. Yes, sir. It appears to me that still there's a heavy reliance upon step 1 and step 2 scores as a determinant for granting interviews.
Sure.
Yeah.
Okay, thanks.
Yeah.
Thanks.
That's Dr. Martin, just to go along, as a former chair, you'd appreciate, and I was talking to a student the other day at another institution, just, you're not picking somebody to be on Phi Beta Kappa, and you're having somebody you're going to be working with in the heat of battle, so to speak, in the emergency room when there's 7 patients come in at once and you need 6 ventilators and you only have 4. And you would still think that personal background, those interactions with other people, colleagues, transporters, nurses, would be so important. And it seems in some ways they're becoming like law schools where they take the LSAT and the QPA and they don't look at anything else. So that's find that fascinating and perhaps unfortunate for what we're trying to accomplish long term. But one final question: is step 1 counting at all now? I'm sorry, Dr. Martin.
Oh, no. I was going to say, in tune with what you're saying, as a former residency director and chair of a department and president of the Council of Residency Directors for Emergency Medicine, holistic picture was better for us. I mean, the students with the higher scores were not necessarily the better physicians, just based on what you were just saying. We were looking at them from a holistic perspective.
And be willing to go that extra yard to help the student. Here, go ahead.
And this is Linda Archer. I just want to say one thing, because I think what we're overlooking, and I totally agree with the holistic approach, and we're doing a lot of work in GME with diversity and inclusion, but I do need to tell you that the residency programs are getting so many applications that it is very difficult to go through each and every one to determine those holistic pieces. And it is very easy to fall back on at least a score is it's quantitative, and it's easy to do that. But program directors across the country are really just struggling with the enormous number of applications. And what is that process you can use to kind of evaluate all those aspects of an individual's? So I don't want the program directors to get a bad rap for the fact that they're looking at scores. I think there are some environmental factors which are really contributing to that.
So is it fair to say to advantage our students as best we can to try to help them or encourage them to get the 1 or 2 away rotations in the specialty and the institution that they can reasonably go to? Because I've certainly seen students, I remember one from about 15 years ago did a rotation at UCLA, and she was certainly in the upper part of the bottom third of her class and got her position there. And it's because she had done an away rotation there.
Now, I think that's important. And I think the other thing that we're working on is to ensure that when our program directors or our chairs have agreed to write letters of recommendation, that we write good, solid, timely letters, not just the the standard letter where you talk about the scores and the clerkship, et cetera, but talk about some of those personal characteristics and those personal experiences. I think in this day and age, particularly in COVID, it's just going to be tough. It's going to be just a really tough year for the applicant. And it's a tough year for the programs in terms of those numbers of applicants, but the programs are going to fill. It is the applicants that are going to really have the challenge.
Right, so it'd be safer for a lot of programs to take a quote-unquote homegrown applicant because there's little risk that they will move out of town or they don't know that particular student very well after 4 years. Well, just another exciting challenge for Dr. Flenner and his team, and they've always been up to it, so we're looking forward to great news. Well, our final reports from our Vice President, Dean of the School of Health Professions, Dr. Coombs. You are on.
Thank you, Mr. Chairman. Really brief in terms of the health professions programs. Our faculty and students, I think, have adapted as well as could be expected in the COVID environment, and things are generally moving forward. I think the faculty have made an incredible effort over the last 9 months to transition a lot of their face-to-face didactic into successful remote learning programs. That's been a challenge, but I think the faculty have risen to it and done very well. Applications are up, interestingly, this year. Next year is now just beginning, so don't really have data about what effect, if any, COVID may have on applications. There are competing theories. One is that it's heightened the awareness and interest in health professions as a professional choice, and so applications may be up. We'll have a better fix of that on our spring meeting. I do bring to you for approval 2 programs, and I can summarize them very briefly. We have had for about a decade the only master's level program in surgical assisting. We started that master's in an effort to help, in conjunction actually with the Surgical Assistant Association, to try to help elevate the surgical assistants professional standing, and it's been a very successful program. We have about 20 students a year in it. Prior to that, from 1982 to around 2008, we had a certificate program, which is the norm around the country. You could get into a certificate program without a bachelor's degree, and back in the late 90s, we started requiring a bachelor's degree to get into our program, but nationwide, you have to have an associate's degree. And there's a disparity in the profession of people who want to be surgical assistants and have the capability to function at that level, but don't have either the interest, time, or inclination to do the academics required in a master's degree. And so we're proposing to reinstate. We're going to keep the program that we have in the master's, but we're going to also reinstate the program we had for about 20 years, where people can get a certificate. They will have all the courses they need to pass the licensing exam for surgical assisting, but it will be a second pathway. And we don't intend that to be as large as the program that we have for the master's program, but we think we can easily accommodate about 10 students a year. And so going forward, our surgical assisting would have 2 options, one for those who want a master's, another for those who want a certificate. The second program, I think, is really exciting as well. That's a Doctor of Medical Sciences program. For those of you that follow the health professions, you may know that nursing about 15 years ago instituted a doctorate in clinical nursing as their terminal degree. And there was a lot of controversy at the time, still is to some extent, about confusion of who's a doctor and not a doctor. But the advanced training in nursing has worked out very well. The PA profession has so far taken the position that the terminal degree to be a physician assistant is the master's in physician assisting, which is the program that we currently have. However, there are increasingly more programs nationwide, and there are more faculty slots, and the interest in having a doctorate at that level, as well as in the clinical level, is growing. And so while the PA profession has continued to say MPA is the terminal degree, within that profession, there's a growing interest in doctoral studies, and there are a number of programs around the country that have created a doctorate, much as we're proposing here. Like the surgical assisting, it's a 1-year program, and the places where it's been instituted, it's been very popular. We have a very strong program here, a strong foundation, and we're excited to build on it. I might, Mr. Chairman, if it's okay, ask Dr. Dempsey to weigh in for just a minute, since 1, she's the one who developed the proposal, and 2, she's a PA, and 3, she's a doctorate. So Kim, maybe you could amplify or correct anything I misstated.
Sure. Yes, it's become increasingly popular in our profession to seek a doctoral degree for multiple reasons. Many people are going into faculty positions and they need a doctorate to help in that respect, but they also want to advance their clinical careers or maybe even go into administration. So they're seeking doctoral degrees for that. Right now, they're getting PhDs, they're getting EDDs. That's what I did. I got an EDD. Some are going to DHSCs, but over the past several years, there have been new doctoral programs, the DMSC, that has developed to meet the needs specifically for PAs, because none of these other programs are specifically geared to PAs in their career advancement. There are about 4 or 5 DMSC programs across the country. They continue to be filled to capacity and have more applicants than they can even review at times. The one that we're proposing is a 2-year degree program. It has 36 credits, which is about the average for across the country. It has a contemporary dissertation, which will help them whether they're going into their academic careers or their clinical careers, in that they do a literature review, but they'll also, as part of the dissertation, have a chapter that is a grant proposal, and then a chapter that is actually a publishable article. So this will help them as they advance through their clinical or their educational degree.
Great, thank you, Kim. So, Mr. Chairman, we're bringing to you 2 proposals. Our continuing effort to selectively look at the health workforce and where there are opportunities that we think we have a competence to mount a program that'll make a difference. So I commend them to you for consideration. Happy to answer any further questions.
Anyone have any questions for Dr. Dempsey or Dr. Coombs? If not, I'd ask for a motion for approval for reinstatement certificate program in surgical assisting and for the 2-year Doctor of Medical Science program. If we could have a motion, please.
So moved.
Second. Okay, Yolanda, can we do the roll call, please? I think, Yolanda, you're on mute.
Sorry. Ms. Scott?
Yes.
Mr. Hughley?
Yes.
Dr. Joffrey?
Yes.
Dr. Martin?
Yes.
Ms. Morris?
Yes.
Dr. Walthouse?
Yes.
So moved.
Thank you very much. Our final reports from our Vice Dean of Graduate Medical Education, Dr. Linda Archer. Dr. Archer.
Linda,
you're mute.
Yeah, sorry. I'm working off an iPad and periodically messages come up and I can't get to the unmute button. My report's fairly quick. All of our eligible ACGME accredited programs remain under ACGME full accreditation. We did have a site visit, a 10-year self-study site visit for the PM&R residency and the PM&R pain fellowship, and we should get the results of those back probably in 6 weeks. My exit interview with the site visitor revealed no surprises. We were very aware of some of the issues we had in that program, and we've been working to enhance and correct some of those deficiencies. Our podiatry residency program remains under full accreditation from the Podiatric Council for Medical Education. So from an accreditation standpoint, we're in great shape. We have an application going in this week for an integrated plastic surgery residency. What that means is that the medical student matches directly into plastic surgery as opposed to going through 5 years of surgery in the plastics fellowship. I'm not sure that we'll have an entering resident for 21-22. It may be 22-23. We'll have to determine that after we see about the accreditation status and then review our resources. We just had last, I believe it was Monday night, a virtual open house, which was aimed at underrepresented minorities in medicine, but was open to all applicants to EVMS programs. It went great. We had over 100 attendees. And I've got Dr. Shruti Patel, who's the chair of our Diversity and Inclusion Committee and also the program director for psychiatry, reporting on that at the Graduate Medical Education Council tomorrow. feedback I received was that it was incredibly well received by the students, and we may potentially do one more, and we'll definitely do them again next year. The only other update I have is that we volunteered to participate in a ACGME Clear site visit, which is the clinical learning environment, and that's a part of the accreditation. And basically what it does is it looks at the integration of the residents into the hospital and the engagement of the hospital in the residency program. So you don't have to pass it. It's not a pass-fail. You just have to have one. ACGME developed a new protocol, which really was looking at the impact of COVID on the educational programs. They called me and asked if we'd participate as a beta site, which we did. And the major change with this site visit is rather than requiring the DIO, who's me, and the hospital president, we were the only two required people to be in the meetings. They required the system president. So for this particular site visit, Howard Kern participated as well. We have just received the report, and again, it doesn't rate us, it merely reflects what they observed. And I'll be giving a report on that tomorrow to the GMEC, and I can give that report at the next meeting of this particular committee. So unless there are any questions or comments, that's the completion of my report.
Very exciting, particularly the opportunity to have open house and to bring a potentially diverse group of students, and perhaps moving forward as we look at maybe a longer plan of getting students from our community at younger ages and high school level, even earlier, interested in science, may have a unique opportunity to serve our communities moving ahead with diversity. Are there any old business anyone wants to bring up? No, I'll ask if there's any new business anyone wants to bring up. Okay, well, if not, I want to thank everyone, including our full-time staff. Those of us on the board, really thank you so much for what you're doing in a very, very difficult time with limitations on time, resources, ability to communicate directly for our students as we move forward with our academic endeavors. Could we have a motion for adjournment, please?
So moved.
Do we have a second?
Second.
Yolanda, do we need a roll call for that too, I guess?
Okay. Ms. Scott?
Yes.
Mr. Hughes?
Yes.
Dr. Joffrey?
Yes.
Dr. Martin?
Yes.
Ms. Morris?
Yes.
Dr. Walhouse?
Yes. Well, healthy and a happy new year and happy holidays.
Thank you.
Thank you.
Thank you. Bye.
please start the stream. They're ready to begin.
Okay, we are live, Dr. Wagner.
Thank you. Good morning, everybody, and some of you for the second time. It's great to see everyone. And as you know, we're meeting by electronic means today. It's permitted by Virginia law during the state of emergency that was declared by the governor due to COVID-19. This meeting will be held entirely in open session today and is going to be live streamed and recorded. All votes today will be done by roll call to make it clear for everyone. So our first order of business for everyone is the approval of the minutes. I'm happy to take a motion.
So moved.
Second. A second. Any discussion about the minutes? Hearing none, I'll call for the roll call vote, please.
Okay, Dr. Wagner,
Aye.
Admiral Bianchi,
Yes.
Ms. Bishop,
Yes.
Dr. Emery,
Yes.
Mr. Hart,
Yes.
Dr. Martin,
Yes.
Dr. Waldholtz.
Yes.
Right, that's everyone.
I hereby unanimous approval. Thanks, everybody. We move quickly to the external auditor update. Our friends from KPMG have a report today.
Thanks, Dr. Wagner. I'll go ahead and kick it off. This is Trey. Again, I apologize for not being on the Zoom meeting. I'm down at UNC Hospitals for Dad. But Nick's going to kind of go through the status update as it relates to the single audit. To level set, the past meeting, we presented the results of the financial statement audit. And then from there, we, as well as internal audit, have pivoted over to execution of the single audit. So I'll let Nick do a status update on that now.
Thank you.
Yes, so very brief update for the committee today. Our fiscal 20 audit report was issued back on October 30th, for which we presented the results to the committee during the scheduled special meeting. And since that time, we've pivoted and are currently progressing towards the completion of the uniform guidance audit with management and internal audit. The major program selected for the uniform guidance audit is student financial assistance. And at this time, there's nothing to report that warrants the attention of the committee. So short and sweet update there. Dr. Wagner, back to you unless there are any questions.
Oh, no news is good news and no surprises is even better.
That's right.
Thank you very much. Great work. And next is the internal audit update. I believe, Barrett, you're up.
Yes, sir. Thank you.
Thank you.
Clicking on the internal audit update link there on the second page under 1.2 audits. The facilities fiscal year 19 management audit that was completed and the report has been issued. There was one finding that was assigned a low priority rating, and the corrective action is in progress. As Nick just mentioned, for fiscal 21, the financial aid audit fieldwork is currently in progress. As a general comment, things are progressing a little slower than they normally would under normal conditions. But we are getting the information, we're working through it. We don't anticipate being able to complete things prior to the holidays as we had hoped, but we should be able to wrap that up sometime in early January, our portion of the work at least. Over on the next page for the annual audits, we've started planning for the indigent care audits. That's in progress. And the procurement card audits are about 80% complete at this point. And that is all I have right now, unless there are any questions.
Floor is open. Any questions, anybody? Our rocket docket today. Thank you very much, Barrett. Ms. Purcell, you're up.
Yes, and I also have a relatively short report, so I guess we're continuing with that. Since our last meeting, we finalized the EVMS infectious disease preparedness and response plan that was required by Virginia Department of Labor and Industry, the emergency temporary standards that came out. I know we talked about it last time. That's been rolled out to the whole community. Since we have both medium and high risk employees, we continue to train faculty, staff, residents, and student employees. We typically train residents on our regular annual training of employees and residents. We typically do residents in the August timeframe, and we typically start employees in this kind of mid-December timeframe. We skipped over the resident training. We're pushing both to the start of the new year because we have done numerous COVID trainings that we've had to push out. So we delayed kind of both trainings. We're going to start those both at the start of the new year to get those out. We have had hotline complaints, 13 new complaints since our last meeting. There's definitely been an increase in patients using the hotline and also people talking about masking, social distancing, some of those type of complaints going through. So it's been more than normal, but nothing that rises to a high level. And this time, I guess as a Christmas present, I only have one policy for review, and it's a revision to the criminal background check policy. It's a human resources, and this one is a revision. It used to be up to the discretion of the department whether a criminal background check was run on a new hire, and we have revised that policy so that it is on all employees. So it's just a small tweak in that beginning paragraph. Otherwise, there was a change to Matthew Shank's title. So whenever we do a policy and titles change, we fix that too. So otherwise, it's just that one. I'll take any questions on the report or on policy, and if there are none, I would ask for a motion for approval of the policy.
Floor is open for motion.
I move to approve the policy as presented.
Second. Got a second. Floor is open for conversation, discussion. Hearing none, we'll call the question. May we proceed with the roll call vote, please?
Dr. Wagner,
Yes.
Admiral Bianchi,
Yes.
Ms. Bishop,
Yes.
Dr. Emery,
Yes.
Mr. Hart,
Yes.
Mr. Lewis, are you on the line? Dr. Martin,
Yes.
Dr. Wadholz.
Yes.
Right, that's everyone.
Okay, that passes unanimously. According to my agenda, we have gone through this with alacrity, and we're now at other issues. Does anybody have any other issues to bring up? New business? Well, thank you for your participation. I think this is one of the better committees we could have.
It's very efficient. I'll say.
That's how we roll, baby. It's how we roll. Born ready. Well, thank you, everybody. I guess we'll tune in at the same channel, same time next time, but we'll see you probably in a few minutes.
All right.
Talk to you soon.
Thanks,
everyone.
Hey, Rob, I may be a little late getting on finance. I've got an issue to deal with here at work today, but I plan to attend the rest of the meetings today.
Raj. Thanks, Jeff.
Yeah, thanks, guys.
Yeah.
Bye-bye.
Bye, everybody.
Bye-bye.
They're officially done with this meeting. So to speak.
Thank you, Jill.
Okay.
Please start the screen for the finance committee.
You think we should be used to this by now?
Routine.
We're not going to know what to do when we go back to in person.
Yeah.
Somebody's going to say, stop, you can't talk.
We are confirmed. We're good to go.
We're confirmed, good to go.
Okay. So we'll call the Finance Committee meeting to order. Thank you all for being here today. We are meeting by electronic means as permitted by Virginia law during the state of emergency declared by the governor due to COVID-19. This meeting will be held in both open and closed session today. Open session is being broadcast live, is being recorded, and will be posted on the EVMS website. We will begin an open session, and following a motion and vote of the committee to convene in closed session, members of the committee and EVMS personnel will proceed in closed session. Following the closed session, the committee will return to open session. All votes taken today will be done by roll call. And I'd ask that you mute audio if you're not speaking to prevent any feedback. So as you can see, we do have a pretty full agenda today. We have a bond issue that we will be looking for a vote on, and then we'll have a discussion during closed session on some real estate negotiations. But to start, first order of business will be to review and approve the minutes. So if there are no issues with the minutes, if I could have a motion for approval.
Move to approve.
So moved. Second.
Okay, moved and seconded. May I have a roll call vote there, Linda?
Yes, please say yes if you approve the minutes. Rear Admiral Bianchi,
Yes.
Dr. Bibbins,
Yes.
Ms. Bishop,
Yes.
Mr. Hart, Dr. Latanzio,
Yes.
Mr. Lewis, Litton, Ms. Moore,
Yes.
Dr. Wagner,
Yes.
Dr. Emery.
Yes.
Approved.
Okay, thank you, Linda. So our next order of business will be a review of our finances. Camille will lead us through this. We're in a pretty solid position right now, and given the other topics on the agenda today, I've asked Camille to kind of step through the financial reports gingerly, but obviously if there's any questions, we can spend time as appropriate, but I wanted to make sure we have enough time to discuss the other two matters there. So Camille, if you would lead us through the financial statements.
Thank you. Yes, if you're following along on the diligent board, I'm going to start on page 8, which is the statement of activities by mission. And I'm happy to report that the overall net access of $7.3 million. And the breakdown is of core being a positive variance of 2.6 million. Sponsored research has an unfavorable variance of 0.5 million. The department reserves has a positive variance of 3.2 million. The EVMS reserves has a positive variance of 0.9 million. Property, plant, and equipment also has a positive variance of 1.1 million. And stepping through the next page, there's a new statement that we've added this month. This is really to better match the monthly financials with the audited financial statements. And the two columns that I wanted to highlight are titled the net assets with donor restrictions. This really is to highlight the release of restriction on revolving student loan revenue and net investment in plant. If you go to the page 10, we're going to talk about the core net excess a little bit. Mainly this is due to positive variance in salary and fringe savings from vacant positions, which is offset by transfers from EVMS reserves. Other positive core variances include the clinical enterprises 20%, facilities administrative cost recovery, and travel savings. This is offset by a negative variance in standardized patient revenues and investment income. The next page I'd like to really talk about is the sponsored research page, which is page 12. Wanted to discuss the new accounting standard, which is 2018-8. This really clarifies the guidance on how grant contributions are received and recognized. With milestone-based awards, typically there are donor-imposed conditions which need to be met for revenue to be released. The timing of this, when this revenue is recognized, is not always in the same fiscal year of when the activities happen. And this is really what's causing the unfavorable amount this year of 0.5 million. Keep in mind the activity reflects only the revenue and expenses recognized for this fiscal year and not the life of the awards. Last year at this time, we did have a positive variance. The next page is the clinical enterprise. Dr. Starter will be providing a report later in the agenda. However, I did want to mention the operating margin for the practice plans were 2.1 million more than budgeted and 3.1 million greater than this time last year. On the department reserves on page 14, we have a $3.2 million positive variance, mostly due to savings in salary and fringes, operating expense, and lower than budgeted transfers from EVMS reserves. With the property, plant, and equipment on page 15, the state appropriations has a larger variance due to a timing issue of when equipment is approved from last year and purchased in the following year. EVMS reserves, the projects are not allowed to spend over budget, and COVID has slowed some of the projects down. This year we have a net excess of 0.9 million, mainly due to less than budgeted operating expenses. And all in all, as you can see, things are looking really good at this point, and I have no negative trends to report.
Okay. Any questions or discussion for Camille?
I will be happy. May I ask a question?
Yes.
Okay. Camille, would you explain the negative funds flow related to standardized patients, or what would be positive flow?
Sure. So because of the restrictions of COVID, travel and large gatherings are not allowed. And so patients coming in are opting to not participate at this point.
Right. So wouldn't that be a positive variance if we're not paying the expenses for the patients to come in?
So it really offsets. So that we're not getting the revenue. However, we're not having the expenditures as well. So
okay.
Yes,
Got
correct.
it. The duality. Okay, thank you.
Where does the revenue come from for that? Is that EVMS revenue that supports the?
So it really depends what the studies are involving.
Okay, it's study-based. Okay, thank you.
We also provide, so our standardized patient provide, these are the ones that they mock different diseases or, and they train other individuals on, different things. And so our center over in Lester Hall, we have a very strong program, and we contract out with other organizations, other schools, other organizations to be able to, so our standardized patients go to these locations and provide the training to those sites as well. So, and they've been very limited on being able to do the travel, so they haven't been able to go to those sites.
Thank you.
A quick question. Maybe it's going to come up in Kurt's report, but was there an acceleration of next year's CMS payments for support of the faculty medical program and practice that we have to concern ourselves with making up with cash flow for next year? I don't see that on the clinical enterprise balance sheet here.
Kurt, can you answer that?
You're muted, Kurt.
Sorry about that. I can report that in my overall update if you'd like.
Okay. Yeah, I just know for most of the practices, it was very helpful, but then it looks really good on this year, but next year it's going to look a little tough as they take it back 25% over the first 6 months and then 50% over the last. Thank you.
Okay. Any other comments or questions? All right. Well, thank you, Camille. Appreciate that. So the next item is a bond issue. And so I'm going to ask Helen to talk us through this one. Basically, we're looking at taking out a bond next year, and she'll go through the details of the proposal so that we can take a vote on it to move forward with that. So, Helen?
Okay. If you want to look at some more detail on, if you click on the 2021 link on Diligent or page 29 in the Diligent package, for the past couple of years, we've been talking about two bond issues to fund several of the projects on campus. The first one was the 2018 bond issue that we borrowed $10 million in December of 2018 to fund the Waiter Hall and to start the Hay Club apartments and do some lab renovations at Lewis Hall. The rates of these bonds were 3.46%, and we drew down the funds as we needed them with the expectation that we would fully expend that $10 million in December, right now, 2020. So we had 2 years to draw. To date, we've only drawn a little over $6 million. This was due to fundraising for Waiter. We didn't need as much money as we originally planned for Waiter Hall, as well as several of the projects were delayed due to COVID. After discussing with our financial advisors, we determined that it would be better to not fully draw that 3.46% debt and to roll that into what we had already planned for 2021. We do believe that we will get a lesser rate right now. The rates are looking at 2.5%. We've been looking at projections. If we're putting in our models 2.75 to adjust for some timing issues potentially between now and when we issue. But we felt like that was the best decision, most financially prudent decision to roll that into the debt that we were already planning. Then we had already, with the 2021 bond issue was approved by the board in March of 2020. This was a bond issue. The board approved $10 million issuance to fund renovations in Andrews Hall and to fund some renovations in the Brickell Library for the Academy of Educators. And so that was scheduled to be done in 2021. And so that was the bond issue that we're going to roll the additional funding in. The budget that we had requested to get us to the $10 million was initial estimates. And now that we've gotten with have all the design work and worked with the contractors, the scope has changed, and we're going to need an additional $4 million. This is mostly due to the Hay Club renovations. That's the largest scope change. And that was due to unforeseen conditions for the apartments. These are apartments across the way. They're at the corner of Colley and Olney. And we have 81 apartments that house the students' that are available to our students and residents. We did evaluate the Hay Club project to determine whether or not this was something still that we wanted to do, and whether or not we wanted to decrease the scope or what it was that we wanted to do. But we felt like it was necessary to keep the apartments viable for the next 20 years. And so we thought that it was something we still needed to do and were committed to do. The rental income will pay the debt service, including the additional debt service. And we're also incurring substantial maintenance costs on these apartments. They were constructed in 1985. And that we're continuously having problems right now with the piping and other things. So we've really got to fix them. So it is something that we decided that was necessary to do. So we are asking the board to increase the 2021 debt from the $10 million that was originally approved to the $18 million. And that's made up of the $10 million plus the rollover debt of 3,975, which is the debt that was coming from 2018. So that does not increase our total debt load. That's just a rollover from one year to the next. And then increase for the project change of $4,024,000. We did evaluate where we are financially. If you go to slide 30 in diligent, we just looked at our financial position compared to where we were and when we initially asked for this funding, as well as where we had been historically. As you can see from this chart, we're a substantially stronger financial position than where we were back in in 2012, 2013 timeframe when our debt went up to $65 million. At that time, that was the funding for Lester Hall and several projects on campus. Right now, this will bring our total debt up to $52 million. Our net assets, our unrestricted net assets are $177 million, and our cash and investments are $123 million. So management is comfortable with this increased debt for this bond issue.
Okay, so any questions or discussion on this proposal? And so just to be clear, what we will be voting on is basically a recommendation for them to move forward, working with the bank to structure this bond issuance, and we would conduct another vote, right, Helen, when we're actually ready to execute the actual final issuance. So this is really giving them a green light to proceed with the negotiations on this issuance. Okay, so hearing no discussion or questions, I would like to ask for a motion to recommend to the board to approve an increase in the 2021 calendar year bond issuance to a total of $18 million, which includes $10 million from the approved March 10th, 2020 bond issuance, plus the $3,975,429 not incurred from the Series 2018 bond issuance and carried over in order to achieve interest savings, and $4,024,571 of additional debt. So
Motion.
I have a motion. Motion is on the floor. Second?
Second.
All right, motion has been seconded. Any discussion?
Call for the question.
Okay, hearing none, may we have a roll call vote?
Rear Admiral Bianchi,
Yes.
Dr. Bibbins,
Yes.
Ms. Bishop,
Yes.
Mr. Hart, Dr. Latanzio,
Yes.
Mr. Lewis, Mr. Litton, Ms. Moore,
Yes.
Dr. Wagner,
Yes.
Dr. Emery.
Yes.
Okay, so the motion carries. Thank you. All right, at this point, Dr. Stouter, if you can give us an update on the medical group, some good results here.
Sure, I'll try to give you a little more granularity. I'll restate the bottom line, or we call the net excess. We had a net excess of 5.4 million, of which better than budget by 2 million and better than prior year by 3 million. Lower expenses and change in our accrual method for PSPP revenue is largely attributed to that year-to-date variance, positive variance. We did have about 400,000 greater patient revenue compared to prior time period last year, and we had about $1 million greater in accrual for PSPP. So specifically, prior to this, we did not record the PSPP revenue until we actually received a check. But through our updates, we started projecting what the PSBP, so we went on an accrual method. We also are receiving higher PSBP payments. So that is contributing to the better than budget and better than prior year performance. In breaking down the total revenue, there's two areas. It's patient revenue and it's contractual revenue. Both are doing better than budget and prior year performances. Also, our gross charges are performing better by about 2% prior year. So our expenses, I guess to sum it all up, we had a ramp-up plan as a result of coming out of COVID. That has contributed us to rebounding quicker. And I've got to give a lot of credit to the faculty and staff for the heavy lifting. But they really have increased their volume, not total volume back to the state where we were prior to COVID, but very close. Also, managing costs, reducing costs, largely around not filling and delaying replacement of staff, and also vacant positions around faculty. Managing the expense side has also helped us. So it's really a combination of revenue and managing expenses and greater revenue from the PSPP program. To your question specifically, we did not receive a grant or advancement from Medicare, so we are not predicting, we didn't get a PPP loan. We did not get other support that was available, so we're not predicting any payback.
Okay, thank you.
Sure. Any questions that I can answer?
Wow.
I have a question. There is additional PPP funding supposed to be coming. Is it our size that made us ineligible or something else for the PPP monies? And there will be new ones available, I think, here with this new bill in front of Congress now.
The PPP structure, originally we estimated we would receive about $8 million. After further review with attorneys and the accountants, it was determined due to our structure with the affiliation agreement with the medical school that we were not eligible. So we refunded that $8 million. We're not predicting being eligible for future PPP dollars as well.
Thank you.
Wow, thank you.
Okay. Any other questions or comments for the doctor? All right. Well, again, great results there. Kurt, appreciate your update.
Thank you.
All right. Is there any new business for the committee? All right. Hearing none, then I would ask for I will request a closed session pursuant to Code of Virginia Section 2.2-3712 Alpha to discuss and consider the disposition of real property where discussion in an open meeting would adversely affect the bargaining position or negotiating strategy of the public body as permitted by the Code of Virginia Section 2.2-3711 Alpha 3. So do I have a motion to go into closed session?
So moved.
Second?
Second?
Thank you. Linda, will you do a roll call?
President Bianchi,
Yes.
Dr. Bibbins,
Yes.
Ms. Bishop,
Yes.
Mr. Hart, Dr. Latanzio,
Yes.
Mr. Lewis, Mr. Litton,
Yes.
Orr,
Yes.
Dr. Wagner,
Yes.
Dr. Emery.
Yes.
Approved.
Okay. So we'll stand by until you give me the signal. It never makes sense to me that you come out of closed session to request going out of closed session. It's just some things, that's why I always get messed up on that one.
Me too.
Yeah.
We're good to go.
Okay. So we're now in regular session, and I ask for a motion to come out of closed session and to certify that, to the best of each member's knowledge, only public business matters lawfully exempted from open meeting requirements that were identified in the motion authorizing the closed session were heard, discussed, or considered in closed session. I have a motion. No motion.
Moved.
Second.
Second.
Linda, roll call, please.
Dr. Admiral Bianchi,
Yes.
Dr. Bivens,
Yes.
Ms. Bishop,
Yes?
Mr. Hart, Dr. Latanzio,
Yes.
Mr. Lewis, Mr. Litton,
Yes.
Ms. Moore,
Yes.
Dr. Wagner,
Yes.
and Dr. Emery.
Yes.
Okay. Thank you all. This will adjourn the meeting, and we've got about 9 minutes before our full board session. Thank you all for your insights and comments today. Great session. Appreciate it.
Thank you.
Yes.
Good afternoon.
Mayor, how are you?
Good. Be here.
Good to see you. Hey, Sharon.
Hi, how's everybody?
Good.
Okay.
Good. Cold.
It's so odd to sit still for so long. You know, I'm usually in the clinic all over the place.
Yeah, we were streaming on web.
Dr. Emery, we are confirmed that we are good to start the meeting.
Okay, great. Good afternoon, everyone, and thank you for attending. We're meeting by electronic means today as permitted by Virginia law during the state of emergency declared by the governor due to COVID-19. This meeting will be held in both open and closed session. The open session is being live streamed and recorded. Following a motion and vote of the Board of Visitors to convene in closed session, members of the board and EVMS personnel will leave the open session and proceed in closed session. Following the closed session, the Board of Visitors will return to open session to certify that only public business matters lawfully exempted from the open meeting requirements and which were identified in the motion authorizing the closed session were heard, discussed, or considered in closed session. All votes today will be done by roll call vote. So I'd like to ask for a motion to approve the Board of Visitor minutes from the meetings that were held September 15th, 2020, October 7th, 2020, October 26th, 2020, November 11th, 2020, and November 30th, 2020.
Move approval.
Second.
Is there any discussion or corrections? Okay. So do we need to take a vote then for that?
Yes, ma'am.
Yes.
Hi, Terry.
So do the roll call.
Did you hear me? Do you have us still live?
Yes, go ahead.
We need a roll call? Yes, ma'am.
Yes,
Okay,
please.
Dr. Joffrey?
Yes.
Dr. Joffrey? Okay.
Yes.
Riadmo Bianchi?
Yes.
Ms. Bishop? Ms. Bishop? She's dropped off. Okay, Ms. Moore?
Yes.
Dr. Emery?
Yes.
Mr. Frame?
Yes.
Goodwin?
Yes.
Mr. Lewis?
Yes.
Dr. Walpoltz?
Yes.
Mr. Hart?
Yes.
Mr. Lindsay, is he on today? Mr. Litton?
Yes.
Dr. Martin?
Yes.
Dr. Wagner?
Yes.
Mr. Hugh, please?
Yes.
Dr. Bibbins?
Yes.
Ms. Scott? Scott? Okay. Director, roll call vote is complete.
Okay, thank you very much. I'll pass it over to Dr. Homan, the President and Provost, giving the report, his report.
Thank you. Thank you, Rector. As you can see in the packet, we have the usual appointments and promotions recommendations, which were provided to me through the AMP committee and vetted through the Office of Faculty Development and Academic Affairs. And they're before you for community faculty, full-time salaried faculty, full-time non-salaried, and promotions. All of them have been recommended through the usual process, recommended to me, and now are before you for approval and a vote. So we'll need to have a vote on the approval of the promotions and the appointments.
So can there be a motion, please?
I'd like to move.
Second.
And please, a roll call, please.
Dr. Joffrey?
Yes.
Riadmo Bianchi?
Yes.
Ms. Bishop?
Yes.
Ms. Moore?
Yes.
Dr. Emery?
Yes.
Mr. Frame?
Yes.
Goodwin?
Yes.
Mr. Lewis?
Yes.
Dr. Walpoltz?
Yes.
Hart?
Yes.
Mr. Litton?
Yes.
Dr. Martin?
Yes.
Dr. Wagner,
Yes.
Mr. Hugh, please,
Yes.
Dr. Bivens,
Yes.
and Ms. Scott. Okay, she's still having difficulty. Rector, roll call vote is complete.
Thank you. And Dr. Homan,
I'll
you have a
proceed with my presentation now. I'll try to be brief. It'll be come up on your screen momentarily. So what I'd like to do is to review some of the initiatives we've developed. This was well in the making over the last year or so, related to our strategic plan, related health disparities initiatives we have funded, and we've received funding from the affiliation agreement through Centera funds as well. I want to give you an update on the accreditation. We do have a COVID task force update. We've been actively engaged in making sure that the campus is safe. And I want to let everyone know that to date, we haven't had any infections from within the campus itself. All the infections have been related to any clinical activity for residents, predominantly some faculty, but mostly in the social environment for students and staff that are at home. So we have to be very vigilant. And I'll review the path forward process. So I'll run through these very briefly. That we have one new center that was developed and will be approved through the Academic Affairs Committee for a Center for Maternal and Child Health, Equity, and Advocacy. This is developed with the Department of OB. Dr. Abed Hamid and I have been working on this for a while. I provided him $1 million of research funding about 3 years ago. I put in $600,000. It's a $2.5 million project over 5 years. And we're recruiting an individual who required some research component, and we're really proud to have Dr. Lindsay Robbins, we just recruited from University of Alabama, Birmingham, who's completing her MFM fellowship. She's a grad of University of North Carolina and went to the residency program there, is now in her fellowship program. She's going to lead the program together with resources for PhD in biostatistics, individual involved with public health, and then we're also going to hire a faculty member in pediatrics part-time to be able to help to develop this as a joint program between us, ODU, and Centera NKD. Second program is a health disparities initiative that was established about 5 years ago, and I believe Mr. Hart is very familiar with this. We had a Western Tidewater Diabetes program, which was funded through the OVC Foundation. The foundation wound down its funding. We looked to see if we could get funding for this from Centera through the affiliation agreement dollars that I negotiated, but it took over a year, and they never came to closure on it. So given the incredible burden of that community with diabetes, pre-diabetes, we elected to fund it internally. So we have $750,000 over 5 years that I'm funding for this project, which has an articulation between EVMS and the OVC Medical Center there to do case management of high-risk patients with diabetes and provide extensive screening and management of patients with prediabetes and diabetes in that region. So we're hoping to really try to identify ways to move the needle on the health metrics in diabetes in the Western Tidewater area, which has an extraordinary burden of diabetes epidemiologically. The next is related to an integrated neurodegenerative disease center. And this is a great way to be able to develop scale related to the Goldrich Institute for Integrated Neurosciences. It was just funded through the very generous gift from the Goldrich family. What we've done is developed a research program looking at biomarker development for Alzheimer's and Parkinson's disease. We're going to be looking specifically at the disparities at CSF, the fluid around your brain from spinal taps that are obtained in our biorepository to determine whether there's some changes in some of the biomarkers for these diseases so we can get a better opportunity to diagnose them more effectively. We're also going to be using other body fluids and blood, but look at least to have 30% of the patients studied to be from the African American community. And that way we can identify if there's a disparity in the burden of these neurodegenerative diseases, Alzheimer's and Parkinson's, as it relates to the biomarkers and how those biomarkers can help for diagnosis, therapy, and be markers for demonstrating whether there's a therapeutic benefit. And that's going to be 1.1 million over 5 years. And this is funded by the EVMS Centera affiliation agreement that I negotiated 3 years ago. Just to remind you again, for the Goldrich Institute for Integrated Neurohealth, there are really 3 pillars. One is for cognitive disorders, Parkinson and movement disorders, and palliative care support services. So we're looking to recruit a new palliative care expert to develop a program for these patients we're going to be seeing. It's going to be predominantly, as I mentioned previously, a clinical program in conjunction with Centera Medical Group. The co-director will be Dr. Karen Thomas, who is the leader in movement disorders in this region. And we're working together with her, with a geriatrician to be recruited in the cognitive area, and the palliative care individual will recruit to identify better ways to be able to provide holistic care for patients with the neurodegenerative diseases. And so we're really excited about this, and I just want to also thank the Goldrich family for their work. It's $11 million over 5 years. I'm providing $3.5 million of in-kind support for this program as well. So we have skin in the game, and we want to make sure that we do this well. So we have a steering committee that's in the process of looking to see how we can roll this out quickly. Let me stop there and see if there are any questions before I get to accreditation. Okay, hearing none. The SACS accreditation, we're still in the process. As you recall, we had the submission back in September 19. We almost were site visited, but COVID hit us within a week and they had to defer it. So now we have our site visit in February 16th to 18th of this next year. And the final decision will be forthcoming in December of 2021. The area that we have to focus on for the SACS accreditation, because essentially it's an administrative audit function, and they've accepted most of the issues that we put forth, and they have an on-site visit to be able to review some of the data that's required for SACS, but they focus predominantly on the quality enhancement plan, the QEP. And this dovetails well with our efforts for health disparities and health equity, and our previous strategic plan. And the title is Live Humble. It's focused on cultural humility to identify ways to roll out a curriculum, first for the medical students, to identify ways to be able to understand their perception, identify some of the skills they can have so they can have some self-reflection. They know what the sensitivities and beliefs and priorities are of the patients they're going to be serving. And that way they can recalibrate and understand better how to take care of patients from other cultural and ethnic populations when they're in practice in the future. So it's really a way to try to provide an opportunity for our students to be able to be taught a process to improve the capability for them to be good citizens, to understand the community in which they serve, and to identify specifically those individuals from communities that are disadvantaged. We'll roll this out subsequently to the health profession school once we have this live in the medical school curriculum. You may get some pushes from us to be able to understand what this is in emails. Please read those, because the site visitors may have an interest in interviewing some of the board members to make sure they're familiar at least with the priority that we put forth. The LCMA, as you recall, we had the site visit team on in October. This was a virtual meeting. They provided me with an exit report. It was the best report this school has ever had. It's not a formal report. The formal report is determined by the actual committee, and the committee meets in February of 2021, and they'll give me a report probably in March of 21. The lion's share of all of the comments that they had are already being addressed. So for instance, one of the issues was the students didn't have identified study space. Well, Waitzer Hall solves that. And we didn't have a survey to demonstrate to the LCME that the students are satisfied with the extra space. But I can assure you they are, because I walk the halls here And they are absolutely thrilled with the extra space they have for study space now. So that's addressed. The other very simple one is that we need lockers in the hospitals for students when they're on call. I mean, these are non-material issues that they raised. Nothing at all that raises the concern related to the curriculum development that we've put forth and the new curriculum we've developed over the last 5 years. So I'm really pleased with the way this worked out. We'll get the final report likely in March. As I mentioned, the task force for COVID meets weekly, twice weekly from May until September, and they meet weekly now because of the surge. I want to thank Dr. Don Combs, who's the chair of that committee. I charged him to be able to identify ways to bring infectious disease physicians in, staff, personnel, a whole array of stakeholders. And we've done testing. As you can see, we have 26 positive employees and students on site here, but we've been very vigilant in terms of social distancing, and we have screens up in different lab areas and in the lecture halls to protect everyone. And I'm proud to say that we haven't had any intra-employee infections. They've all come from outside this institution, except for those in the clinical arena. I did donate 2 freezers, minus 80-degree freezers to Centera. We have those for our research biorepository, and we consolidated the specimens so they could accept those freezers to be able to store the Pfizer vaccine that you may be aware of that requires very low temperatures for storage. Centera has been grateful for that, and it's very difficult to get those freezers now because there's a run on all the manufacturers nationally and internationally because of the needs for the storage and maintenance of that vaccine. All of our policies and procedures track really closely with the CDC, the FDA, and the governor's mandate. So I want to let you know that we actively look at this every week. Any questions?
Sorry, when do we have EVMS employees and students able to get the vaccine?
Well, that's determined by national protocol and by the governor's office. The first individuals that are vaccinated are those in the hospital now that are caring for patients at high risk. So ICU physicians and nurses, respiratory therapists, emergency medicine physicians, the first responders that have the highest risk for exposure. Then it rolls out to the high-risk specialties like ENT that do procedures where they aerosolize tissue, and they're at high risk for exposures. And for OB/GYN physicians, some surgeons. And so they're rolling it out over time, and this is going to align with the national rollout so that eventually we'll have the capability for our employees to be able to get vaccinated as well, but it's going to be subject to availability of the vaccine, how it can be manufactured, because nationally, most of the vaccines are going to go for the high-risk clinicians and then the nursing home patients, and then it'll roll through in a hierarchy from a public health standpoint for the general population.
I should have asked a different question. Will that initial first group include any of the residents actively?
Yes. Yes, we have the vaccine now. They just accepted the first batch, I think, yesterday.
Yes.
So that's going to roll out shortly.
Okay. Thank you.
Dr. Holman, could you go back to the previous?
High-risk areas.
I'm sorry, could you go back to the previous slide? I had a question about a data point. Yeah.
Yes.
It says that EVMS has conducted over 500 drive-through COVID tests, identifying 26 positive employees and students. And then the third bullet point under there addresses the positivity rate for EVMS employees and students appears to be 10 to 12%. So there must be some additional testing sites other than the drive-through?
Yes,
Okay.
there are.
Yeah.
And that comes from the hospital for those individuals on the clinical side that may be tested through the hospitals.
Okay. Thank you.
They're the highest risk.
Mm-hmm.
Unfortunately, sometimes the students and employees lower their guard. And I'd implore you all personally as well not to, because we're still at high risk until all the vaccines are going to be distributed, and we're likely to need to have probably 60 to 70% of the population vaccinated before the herd immunity will provide sufficient reassurances that we'll be at low risk for infection. But please, please maintain your vigilance, because we're still at a high risk area, and there's a spike nationally, and there's a small spike here as well, although it has not affected the ICU utilization and our resources in the hospital to date, like it did previously. So just an update on the path forward proposal that I developed. As you know, I did this within about 11 or 12 days before the last board meeting. And we have a process now where I have the clinicians involved in the medical group, and then education, research, administrative, and legal groups looking at that. We're going to develop a tactical plan that will identify all of the constituents and stakeholders to participate, including students, residents, faculty, staff. That'll roll out right after the holidays, and we're working on that as we speak. There's going to be an amendment to it, and I'm hoping that we can get full buy-in from all the faculty, staff, residents, and students, so they understand what the context of this was and how it provides a pathway, not a work plan, but a pathway for us to be able to engage with our partners in the region to try to identify a way for us to be able to be able to improve the clinical and research and academic reputations of EVMS, Centera, and KD, and ODU, as well as improve the health disparities in this region, because that's going to be a real focus of this process, is to identify better ways for us to work in a concerted way to improve the health of the region. So again, we're going to refine the path forward plan, the pathway, and we're going to look at these different domains. We have subgroups that are going to be working on this. I've already charged them. We're going to have a formal process. Dr. Malona is going to coordinate this. We're doing a SWOT analysis and comments, and we're going to embed the wisdom of the group into the final path forward pathway. I have a town hall meeting on Thursday to be able to roll this out. Then I have another town hall meeting for sort of routine business as usual on Friday as well, to be able to communicate this to our faculty and staff. There's still some questions that they have in terms of how this all arose and what it was in response to. And I want to make sure that they know that we're supportive of them, and that we want to try to find an opportunity for us all to work together in the community going forward to meet the needs of all the different stakeholders and the communities we serve. So as I remind you again, this is going to be refined, but phase one is going to be predominantly for funds flow commitment, probably for 1 year. I know Mayor Frame mentioned that in his comments during the last meeting, that he thought 6 months was too short. And then after that, there'll be a due diligence process and governance structure, looking at the different areas in research, education, patient care administration. The focus on this is to identify not only the intended consequences, but most importantly, the unintended consequences, which could affect anyone, including EVMS, including the other institutions. So we have to be very thoughtful in this process to make sure we get it right. You only have one chance to do this well. We want to make sure we are calibrating this in an appropriate way so that everyone is engaged and we understand how we're going to proceed, how we're going to get all the stakeholders engaged, and what everyone's role will be. As I remind you, here's another slide I thought. The budget that we put forth, as you know, was modeled after the Minot proposal in its form only, but predominantly the incremental resources were going to come from funding from Centera and KD, as was outlined. This is the proposed system model that I put together to provide an opportunity for EVMS to continue its brand identity, and for the board, our board, to have material oversight of the health sciences. So to remind you again, the model that I put forth was to have 2 universities under a blended board of visitors with an Old Dominion University system model, where there are 2 presidents, one over the Eastern Virginia Health Sciences University, and that would include the School of Medicine, EVMS, If there's a new school of public health, it would fall under that, a college of health sciences and health professions, and any others that are involved in the health sciences. And then on the academic side would be the traditional colleges of a university, arts and letters, business, honors college, cybersecurity graduate school, etc. With a common board that have 2 members from the Eastern Virginia Health Sciences University side and 12 from the ODU side, with the chair being alternating 2 years between the Eastern Virginia Health Sciences University and the Old Dominion University models. This would ensure that the board, our board, the Board of Visitors, would retain some oversight and have active engagement, not only in the Eastern Virginia Health Sciences University, but the integrated program that would be developed through this consolidation. Again, this is a roadmap that I thought was a way to be able to thread the needle, to meet our needs, to meet the needs of Old Dominion, and to engage the stakeholders in a way that our faculty and staff would feel comfortable that they know they're not going to be essentially recruited out of a position during a merger. That was their biggest concern. And I think we're laying that concern with the communications I put forth and the town hall meetings I'll be having in the future, and engaging them in the new path forward process, a tactical plan. Let me stop there and see if there are any questions.
Dr. Emery, can I ask a couple? It's Paul.
Yeah, go ahead.
To me or Dr. Homan?
No, I was going to ask Dr. Homan a couple questions.
Okay, sorry, I heard my name.
Doctor, the first bulletin said that you had extended invitations to Norfolk, to Centara and Old Dominion. How were they received? How were those invitations received, or have you heard from them?
We have not heard from them yet, and we're in the process now of rolling out the actual plan. We're going to have that public meeting in the last week, most likely the last week of January, and we're going to be looking to see if we can get moderators for that. There'll be more to come, so the board will be informed of what the process and the structure will be. What I'm looking to do is to refine the path forward with this tactical plan, so that it is more complete, and we can speak to it more specifically when we have the public meeting that we called for in the newspaper.
The second question, is there a role for Norfolk State in here, especially if you're going to have a town hall meeting that they could participate in somehow or be invited to?
Yeah, we're going to include Norfolk State as well, and as part of the plan that I put forth too, we were going to include that in the second phase of the due diligence process, where we'd have that community health and board council that I proposed, and Norfolk State would be part of that process to look to see how they could articulate with the opportunity to have pipeline programs for their students into the health professions, identify their participation in a school of public health if that's developed, because they have a master's of social work program that would be beneficial for such a school. So we're going to engage all the stakeholders, try to get a better sense of what the needs are for the community, and that way we can shape the programs and the final recommendations through negotiations to meet those needs.
Rick, a quick question for you. As I understand it, what you're proposing as far as the structure is in place successfully for perhaps 50 or 60 years in many other parts of the country. So the concept of this overall institutional construct is regularly found not to be viewed as overly complex, and would allow us to develop all the forms of the entire structure in a positive fashion. Is that correct?
That's right. I mean, University of California, University of Texas, State University of New York, there are a number, Illinois, many of them have similar structures like this. And the way I structured this one was similar. It's not identical. But it also would retain the identity of EVMS.
Right.
So it would be EVMS at Old Dominion University. And then your diploma would be read as such. But that way, the alumni and the brand of EVMS is retained, because it does have a good brand educationally for residency programs and for our research portfolio.
I understand, and I do agree, but I ask that sort of as a Socratic question, because I think people will be coming at this and say, oh, it's complex, let's do that, and I think it's important to say, this is a successful structure that's been used. And to have a university system is incredibly important. It brings further cavitos or pride to what we're building here. So I think it's important that we nip that kind of concern in the bud from the naysayers.
Yeah, and I think it provides assurances to the faculty and staff that our identity is retained and that there's still the existence of Eastern Virginia Health Sciences University board members that have knowledge and expertise and oversight of the health sciences that ODU right now does not have.
It also proves to be a bulwark or a protection, a bulkhead against, say, a very large interested player that might find us to be, too easily swayed or to have a problem. And it really allows us to have the underpinnings we need to have a very successful organization.
And Rick, this is Marcus. I think this may possibly come out in future discussions, but as you look at the Health Sciences University and the School of Medicine and School of Public Health underneath, and then you got the College of Health Sciences, and other models, there also would be sort of an independent box for a School of Nursing. I see the School of Nursing within the College of Health Sciences, but that's something to consider,
right.
As we go forward.
Now, what I have not done is, and I have done this in the past, I have a different org chart and a different structure for the medical group to create a dual member medical group. It would be entitled the Centera Eastern Virginia Medical School Academic Physician Partners or Associates. And I put that forth. I didn't get a chance to put that in this initial path plan, but I've charged the clinicians, Dr. Stouter, Abba Hamid, Dr. Strasnick, and I'll be working on that as well. Because I already have an existing structure that I worked on 5 or 6 years ago. I presented that to Centera. They were intrigued, but that may be the opportunity because you have to look not only at the academic side here, but what the implications are for a partnership with the medical group, with Centera's medical group. And what happens there as we relate to then all of the volunteer faculty members around the community that would not be formally part of that process, we'd have to make sure we could address those needs as well. And so that's a little more complicated, but I have that in a different written format, but I'm not including it in this presentation today because it's under review to get the wisdom of the clinical group to help me refine that.
And I think it's important that people understand that too is a very successful model, whether you're looking at the Harvard model, at other places, that it works very well and it's a benefit for all.
So I've got a quick question. Just back when you contacted the leadership at Old Dominion and Centera, you gave them a lot of this information. Is that correct?
They received the proposal, yes.
Yeah. So it shouldn't come as a shock. Hopefully they're digesting it and maybe not having heard anything from them. Maybe they're taking it seriously and maybe not. Who knows?
Well, another thing that hasn't been brought up, and I mean directly associated with this, importantly, with us maintaining not only brand but for accreditation purposes, we have to remember that, we know how to do that. EVMS knows how to be successful in accreditation within the health science arena, medicine through the LCME and through SACS accreditation. So again, another reason why it's important for us to maintain an independence while we are under, while we may have this ultimate standards are something that EVMS knows how to do.
Any other questions or comments? Okay, that's all I have today. So I'll just stop there, see if there are any comments or questions, and then we'll proceed with the rest of the meeting.
In sharing this with our partner institutions, have you gotten any feedback on how it's been received? And can you speak to sort of the temperature of the communications?
We provided it to them. I've not had any formal, feedback on it. I know Mr. Gentry has acknowledged he received it. Mr. Broderick did as well. What I want to do is not engage fully in dialogue at this point because I want to refine it further. I wrote this report alone, And the wisdom of the group is smarter than any one individual. So we have to refine this a little bit more fully, and then fully flesh out some of the issues related to the medical group as well, which I had in a separate document, but I didn't cut and paste in this one. But we're going to review that as well. So that's the process. Then we'll have the open public forum. And then I suspect after that, we can start engaging in more formal dialogues.
Rick, this is
Thank
Bruce.
you.
Just one comment about the educational component. Clearly, there's synergies and cost savings with different type of structures with the different groups, but I think we must not lose fact that, as Dr. Roger Perry, who wrote in the paper recently, we're really talking about two different missions, money and education. And if you look at the entire SMG group, as you talked about neurology a few meetings ago, you had to pull the rotation away from them. The entire culture, you know, if you look at the number of first and second year medical students we have in the SMG physicians to help with our longitudinal preceptor program, it's 0.
Right.
I have 3 in my own office. Now it takes money and time. It's not like shadowing a physician or lawyer. You let them go in, it takes their time, all sorts of things. I don't think they're going to miraculously wake up one day and be committed to education unless they're going to pay their own physicians to see less patients and teach students. And that's going to be a tough sell. So in looking at the SWOT analysis, our weakness is money.
Yes.
And their weakness is lack of commitment to teaching medical students if it doesn't make them money. So I just wanted to share that.
You're exactly right. You're exactly right. And that's going to be addressed in the merger of the medical group. We're going to have an affiliation agreement around that creates a funding stream to buy out the time of the clinicians that want to, okay? We don't want to prescribe individuals that don't want to. But those that want to be able to be provided some funding at an academic level, not at a clinical level, it'll be lower, but have an interest in teaching the students and doing some of the supervision of the residents so that we can make sure that there's an incentive for them to do so. But it's even more complicated than that, because think about it for people like you, Dr. Waldholz, that are not part of SMG. I mean, we have to be wary that we need to make sure there may be some funding for you all, okay? Think of it in terms of nested circles, EVMS medical group, Centera medical group, and then we have the non-compensated full-time faculty, then all these volunteer faculty that are in the periphery. There's going to need to be funding to be able to glue all those different centripetal rings together, so we all have a common goal to educate the next generation. That's going to be required as part of this process.
And the other comment I would have, not everybody's equally good at performing operations. Not everybody's equally skilled or desiring to teach. It's very difficult as a surgeon or as obstetrician to let that student, you know, I had the opportunity to deliver 3 babies. My daughter's a student EVMS doing rural medicine, also did, but it's very tough to be there as the attending and to do that and to not want to jump in and do other things. And I think we don't want to be naive to just think because we're going to compensate physicians in basically a for-profit medical group, that they're going to wake up and be wonderful teachers and role models. And that may take a long time. I just want to speak from the one person on the board who's been there 32 years at Norfolk General and seen who's willing to teach and who isn't. So I just wanted to share that because I think it is a moving piece.
That's extraordinarily valid. That's a consideration. And we have to have faculty development to be able to ensure that we have individuals that want to teach and have the skills to teach and understand what the curricular objectives are, so that we have a full array of faculty members, full-time and then part-time and maybe partially compensated, that can fill out all of the educational needs for our medical students, residents, PAs, surgical assistants, all the clinical education that's required. That's the complicating part. This is not straightforward. And Minot had no consideration for that at all. So that's one of the unintended consequences that has to be vetted very closely. We may want to ask you for your engagement in that, Dr. Waldholz, because we want to have individuals that have that perspective that can voice their opinion. I appreciate your comment.
Thank you.
Rick, this is Mark. It's just one other comment from me. You know, I know this is has a ways to go, but in terms of community involvement, particularly including diverse members of the community, we talked about Norfolk State, but I haven't seen in any proposals the inclusion of Hampton University. That may have been consider, particularly from the nursing school perspective?
Well, we have engagements with them with our Med Masters program. We have outreach there as well. And so we want to engage every partner that wants to partner. But the key component of this is to make sure that the intended and unintended consequences to our institution are met. That's my first priority, and our accreditation standards, and that we retain the faculty and can recruit new faculty into the school. So we'll create that community, and that's part of that public dialogue that we're going to have to bring more people in. But the first step is going to be identifying what the funding stream will be, and thereafter develop the community advisory board, essentially, and that's going to be where we're going to have other institutions come in. That's in the due diligence phase in phase 2, if you read the document.
Yeah, thank you.
All right. Thank you. So any more questions or, well, I think we'll move along to the reports from the committees. The first is Academic and Student Affairs Committee. Dr. Waldholz.
Hey, thank you, Director Emery. We met this morning at 10 o'clock. We had some informational items and several items for votes on. Our report from Dr. Linda Archer, Vice Dean of Graduate Medical Education, included the fact that the Integrated Plastic Surgery Residency Program will be beginning, and the first resident will definitely be in academic year 22 to 2023. Depending on timing, it might be 2021 to 2022. And this was based on the need for plastic surgeons in our community, and the fact, unlike most residency programs, you do 5 years of general surgery, and then you go on and match with plastic surgery. Here, the student would directly match into the program. So that was very exciting. The other thing that she mentioned is they had an open house with over 100 attendees trying to get diverse students and people interested in EVMS, and really represents a wonderful opportunity as we strive further to increase the number of diverse and minority candidates. Dr. Ron Flennert, Vice Dean for Academic Affairs, talked about the LCME survey, talked about QUEP, and interestingly talked about the M4 interview status, which, as you know now, is being done by Zoom. So students are having more and diverse interviews. Unfortunately, in the efforts to date to try to get well-rounded students, it really appears that the board score itself remains of paramount importance. He also mentioned the fact that students cannot go for away rotations, which puts a lot of our students at a disadvantage. However, the students in a specialty where we do not have here, for example, residency in orthopedics or anesthesia, were able to go to UVA or VCU. We had reports from Dr. Coombs, Vice Dean of School of Health Professions, and he asked for approval of 2 graduate programs, one for the Certificate of Surgical Assisting Program. It's a certificate program that will have about up to 10 students per year. That's a reinstatement of a program. And finally, the Doctor of Medical Science program that will include physician's assistants. We also had had the report from Dr. Malona, where faculty appointments, and I believe we had already, the committee voted on those for appointments of non-full-time, non-salaried, and promotions full-time salaried. Also, she presented the EVMS Center for Maternal and Child Health Equity, which is really exciting to make a difference in healthcare in our communities. Dr. Homan has talked about before having perhaps double infant mortality rates in the community here. And she also had presentation of candidates for conferral of degrees. That is our report. The question is, which of those do we have to vote on? This is Dr. Coombs' 2 programs.
So, and correct me, someone from management if I'm wrong, but it looks like we need to have motions to approve the appointments, promotions, faculty actions, also a motion to approve the graduate programs, a motion to approve the creation of the Center for Maternal and Child Health Equity and Advocacy, and a motion to approve the candidates for conferral of degrees. I think we could do them all as one motion unless there is any discussion that needs to be carried out. So if you want to ask for a motion for all of those, then we can move forward.
Can we have a motion, please, for all the actions requested by Dr. Malone and Dr. Coombs?
So moved. Second.
Second?
Can we have a roll call? Tracy? Not sure. Can you all hear us? We need to have a roll call vote.
No.
Go ahead now. It's muted. Go.
Okay, Dr. Joffrey,
Yes.
Rear Admiral Bianchi,
Yes.
Ms. Bishop,
Yes.
Ms. Moore,
Yes.
Dr. Emery,
Yes. Yes. I don't know if you can hear me.
Ms. Goodwin,
Yes.
Mr. Frame. Okay. Mr. Lewis,
Yes.
Dr. Waldholz,
Yes.
Mr. Hurt,
Yes.
Mr. Litton,
Yes.
Dr. Martin,
Yes.
Dr. Wagner,
Yes.
Mr. Hughley,
Yes.
Dr. Bibbins,
Yes.
Ms. Scott.
Yes.
Okay, Director, roll call vote is complete.
Thank you. And now if we could have the report from the Finance Committee, Rear Admiral Bianchi.
Yes, well, good afternoon, everyone. So we are currently in a very strong financial position. The committee met and reviewed our October operating statements. Just to give you a quick recap, our net excess right now is $7.3 million. Subcomponents of that, there's a core net excess of $2.6 million, which is due to positive variances in salary and fringe savings from vacant positions, and that was offset by transfers from EVMS reserves for unfilled positions. Other positive variances include clinical enterprises with a 20% positive variance, facilities and administrative cost recoveries, and travel, and this was offset slightly by a negative variance in standardized patient revenues. The sponsored research unfavorable variance of $557,000 was due to new revenue recognition procedures for milestone-based awards. Revenue now is recognized when the donor-imposed conditions are met for revenue to be released, as opposed to when cost matching when expenses are incurred. Department reserves have $3.2 million in positive variance, mostly due to cost savings in salary and fringe. EVMS reserves have a net excess of $924,000, and that's mainly due to just less than budgeted op expenses. And finally, property, plant, and equipment has a net excess of $1.1 million, mostly due to a timing issue of equipment that was approved last year and purchased in this year. Importantly, all bond covenants are currently being met. We also received a very good update on the EVMS Medical Group from Dr. Stouter. And again, as you saw in the financials, they are having a very good year this year with a positive variance. Finally, we reviewed a request to increase a previously approved 2021 calendar year bond issuance from $10 million to $18 million. That's the request. Excuse me. And since we need a full board vote on this issue, I would like to ask Helen to give the full committee, the full board a quick synopsis of what this request entails. And then we'll call for a request for a motion to approve from the full board. So Helen, if you can give the board a quick update of this bond increase request.
Okay, so in your diligent board books, there is a couple of schedules that might provide some clarity on what we're doing. So the last couple of years, we've been talking about two bond issues, one that was done in December of 2018, and one that was planned for in calendar year 2021. The 2018 bond issue was $10 million, issued at 3.46%. It was for the Waitzer Hall and Hay Club apartments, as well as some lab renovations in Lewis Hall. That was a bond issue that we drew down, and to date we've only drawn $6 million, a little over $6 million. It was supposed to be fully expended by December of 2020, and so at that time we talked to our financial advisors, and because it's at a 3.46% rate, and we feel like today we could get a better rate. They're looking at anywhere between potentially 2.5% to 2.75%. We felt like it was better to roll that $4 million that we had not drawn into next year's bond issue to achieve the interest rate savings. So that additional almost $4 million is not new debt. It was already planned for in the 2018. So the 2018 debt will be reduced. At the same time, we're increasing the amount for 2021. The 2021 bond issue was approved by the board at $10 million in March of 2020. Those projects included the remainder of the Hay Club apartments and renovations to Andrews Hall and Brickell Library. That was based on estimates for those projects, and once we got into the design work and got with the contractors, it was determined that the scope, particularly for the Hay Club apartments, had increased. So additional funding will be needed for those projects of a little more than $4 million. And so just so you know, we did evaluate, that's mostly due to the Hay Club apartments because of unforeseen conditions. We did evaluate whether or not all those were necessary and whether or not it still made sense. And we did find that it was a necessary investment into those student housing apartments. And will keep them viable for the next 20 years. And that rental income will be able to fund the debt service for that additional funding, as well as the original funding. So we are asking the board to increase the 2021 debt from $10 million to $18 million. The three components that's made up of is the $10 million that was originally approved in March 2020. The rollover, that was a rollover from the Series 2018 debt of approximately $4 million, it's $3,975,000, and then $4,024,000 of additional new debt. For making this recommendation, we did look at our financial position. There is a schedule on page 78. This will bring our total debt to $52 million. We are in a much stronger position than we have been in the past 10 years. Whereas the debt, in 2012, we had a maximum debt of $65 million. And at that time, that amount exceeded our unrestricted assets. Today, we have unrestricted net assets of $177 million and cash and investments of $123 million. So we are comfortable with incurring this additional debt for these projects.
Thank you, Helen. And so this request was reviewed by the Finance Committee and unanimously agreed to recommend to the board to approve this additional debt and increase the total Series 2021 debt to $18 million with the subcomponents as enunciated by Helen. And so unless there are any questions or comments, Rector Emery, I would recommend, or I would call for a motion to approve this request.
Go ahead. So we'll call for a motion to approve the 2021 bond issue.
So moved. Second.
Can we have a roll call?
Yes. Dr. Joffrey,
Yes.
Reardon Bianchi,
Yes.
Ms. Bishop,
Yes.
Ms. Moore,
Yes.
Dr. Emery,
Yes.
Mr. Frame, Ms. Goodwin,
Yes.
Mr. Lewis,
Yeah. Yes.
Dr. Waldholz,
Yes.
Mr. Hart,
Yes.
Mr. Litton,
Yes.
Dr. Martin,
Yes.
Dr. Wagner,
Yes.
Mr. Euclid,
Yes.
Dr. Bibbins,
Yes.
and Ms. Scott.
Yes.
Okay, Director, roll call vote is complete.
Thank you.
Okay, that completes the Finance Committee report. Thank you.
Thank you, Admiral. We now would like to turn to the Audit and Compliance Committee. Dr. Wagner.
Thank you very much. Good afternoon, everyone. Ours was probably one of the most efficient and happy ones we could have. After the approval of the minutes, we were updated by KPMG's two representatives regarding the external auditor update. There were no variances or unusualities, and it came up clean. They continue to work the plan that was outlined from our last meeting. The internal audit update was presented by Mr. Wood. He reviewed where we are with the present annualized audits, and up to this point in time, there have been 11 audits that have either been completed, pending deferred, and in total or annual. All came out well as far as the projects, the risk-based audits. All so far have come up clean or have not risen to the level that require board evaluation or concern. There are special projects regarding institutional compliance that were reviewed and dealt with and do not rise to the level of the board. There is a policy for action. It's a bit of a change in wording and a change in the description as to who things apply to, and it's regarding Human Resources Criminal Background Check Policy. It expands who should be considered for improved safety and consistency within the operations of the organization, and it further outlines to whom and to where the various actions should take place, and was voted to be reviewed by and approved by the board. That is all I have to say for your Audit and Compliance Committee. So I ask for a motion to approve the change in the Human Resources Criminal Background Check Policy.
So moved.
Second.
Okay, we'll need a roll call vote. Tracy?
Okay, Dr. Joffrey,
Yes.
Rear Admiral Bianchi,
Yes.
Ms. Bishop,
Yes.
Ms. Moore,
Yes.
Dr. Emery,
Yes. Yes.
Frame. Okay.
Yes.
Goodwin,
Yeah.
okay, Mr. Lewis,
Okay. Yes. Are you finished? Oh, sorry.
Mr. Lewis,
Yes.
thank you. Dr. Waldholz,
Yes.
Mr. Hart,
Yes.
Mr. Litton,
Yes.
Dr. Martin,
Yes.
Dr. Wagner,
Yes.
Mr. Euclid,
Yes.
Dr. Bibbins,
Yes.
and Ms. Scott.
Yes.
Okay, Director, roll call vote is complete.
Thank you. And now to move on to the Governance Committee, Ms. Bishop.
Governance met, approved minutes, and I know many of you remember that we are going to be discussing the vision and mission statement. We will do that later this year, and at the request of many of you on the table, we will have a retreat in a way that is most likely, we hope, in person in a socially responsible manner. But at some point in the spring or early summer, we will have a board retreat to discuss a number of situations and issues. You will get a survey to ask if there are topics you want to make sure we address at a retreat fashion. And that's it.
Thank you. And I just want to make sure can you all hear me? Because it seems like maybe you can't. Okay, good. All right, so thank you so much. And it is the end of the year, and I just want to thank this board for being so engaged, for all of the support you have given everyone, to each other, and through this difficult year. I particularly want to thank management, Dr. Hum and the senior leadership, for EVMS's response to the COVID public health emergency with regard to the students, the faculty, the staff, and all of the people throughout this year. It's been incredibly challenging. We come to this end of this year with a good financial situation, much better than I think we could have imagined as we face this public health emergency. Our academics are doing quite well, and the LCME, it sounds like we should have a good report shortly. So I just want to thank EVMS leadership, staff, and the board, and particularly for the support I've gotten throughout this difficult year. And that's really all I have right now. Is there any old business? Any new business? With that, I'd like to ask for a motion to go into closed session pursuant to Code of Virginia, Section 2.2-3712A, to discuss prospective business collaborations and specific proprietary business-related information pertaining to the operations and finances of EVMS as permitted by the Code of Virginia 2.2-3711A 22. Can I have a motion?
So moved.
Second.
And Ms. Morton, can we have a roll call, please? Can we have a roll call, please?
Dr. Joffrey?
Yes.
Giacomo Bianchi?
Yes.
Ms. Bishop?
Yes?
Ms. Moore?
Yes.
Dr. Emery?
Yes.
Mr. Frame? Ms. Goodwin?
Yes.
Mr. Lewis?
Yes.
Allpoltz?
Yes.
Hart?
Yes.
Mr. Litton?
Yes.
Dr. Martin?
Yes.
Dr. Wagner?
Yes.
Mr. Hughley?
Yes.
Dr. Bibbins?
Yes.
Ms. Scott?
Yes.
Okay, Director, roll call vote is complete.
Thank you, and we'll hold until the stream is disconnected.
Thank you. Thank you. We'll let you know. Dr. Emery, we're clear and good to go. We're back in open session.
All right, thank you. I'd like to ask for a motion to come out of closed session and to certify that, to the best of each member's knowledge, only public business matters lawfully exempted from open meeting requirements that were identified in the motion authorizing the closed session were heard, discussed, or considered in closed session.
Move that we come out of closed session.
Second.
And can the Assistant Secretary please take a roll call?
Dr. Joffrey,
Yes.
Rear Admiral Bianchi,
Yes.
Ms. Bishop,
Yes.
Ms. Moore,
Yes.
Dr. Emery,
Yes.
Ms. Goodwin,
Yes.
Lewis,
Yes.
Dr. Waldholz,
Yes.
Mr. Hart,
Yes.
Mr. Litton,
Yes.
Dr. Martin,
Yes.
Dr. Wagner,
Yes.
Mr. Hughes,
Yes.
Dr. Bivens,
Yes.
Ms. Scott,
Yes.
Director, roll call vote is complete.
Thank
Yes.
you.
Wait a minute. Right.
Right. So thank you, and I thank everybody for being here today and taking the time out of your busy schedules. And I really appreciate it and I hope you have happy holidays. And I think the meeting should be adjourned.
Director Emery, thank you for your leadership, and Dr. Holman, thank you for your leadership. This has been an awesome board, and I think we have lots of grounds to cover, and we will move forward collectively.
Thank you.
Happy holidays.
Great. Happy holidays, everybody.
Happy holidays, everybody. Bye-bye.